This is the inferior belly of the omohyoid muscle. Omohyoid muscle, which has got superior belly and the inferior belly. We have seen the superior belly in the anterior triangle, and this is the inferior belly which is visible in the posterior triangle, and in between there is a central tendon. So this triangle is, upper one is called the occipital triangle and lower one is called the supraclavicular triangle or subclavian triangle. So this is basically a recapitulation class. Now it has got, so in the body we can find this is the area of the posterior triangle. We can see this is the outline of the trapezius, this is the outline of the sternocleidomastoid muscle, sternal head and clavicular head. So this is the area of the, and we can get a fossa or depression, which we call it as a greater supraclavicular. Here we can get in between two heads. This is the lesser supraclavicular fossa, and this lesser supraclavicular fossa, we know that is very important landmark when we will perform. So this is the area which is called the lesser supraclavicular fossa, which is very important in between two heads of sternocleidomastoid. That part is very important. Again, this is the boundary of the posterior triangle. In front by the sternocleidomastoid, behind by the trapezius, base is by the middle one-third of the clavicle, apex is meeting of sternocleidomastoid and the trapezius muscle in the mastoid process and of the temporal bone and the superior nuchal line. Now, if it has got boundaries, it should have roof and it should have floor. Roof is formed by the skin, superficial fossa and investing layer of the deep cervical fossa. Already you have some idea. Today's class was, I think the theory class was deep cervical fossa. I told you there are three cylinders. The outer cylinder is the investing layer. Intermediate cylinder of fossa is the pretracheal, and most inside there is prevertebral. স্যারকে আমি বলছিলাম, স্যার বললো যে আমি বলছি কিন্তু ওরা ফেল করে তাকিয়ে আছে। কেন? আমি তো কতবার বলছি তিনটে সিলিন্ডার, জাস্ট ইমাজিন 3 cylinders. So it has got roof, this has got floor. Floor is formed by several muscles. Now this is the roof where we can get the superficial fossa and some vein and with nerves. The vein is nothing but the most important vein, that is the external jugular vein. This external jugular vein, which is formed by we know there's a retromandibular vein, beyond the mandible, retromandibular vein, and there is a posterior that which divides into two, anterior division, posterior division, and it joins with the posterior auricular vein to form this vein, which is called the external jugular vein, which is very much prominent. Superficially, you can see. Okay, madam, কি বললাম? তোমাকে জিজ্ঞেস করছি। রূপ তো এখানে দেখা যাচ্ছে, কিন্তু এক্ষুনি আমি কি বললাম? Which structure? I am very much concerned just now. There are so many structures in the roof. ওই যে হাসছো যে বলো, হি 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 হা হা হি হি হি, হাসো হাসো বলো, টেল মি, হি হি, মিস্টার হি হি বলো, কি বলছি? কোথায় ঘাট হতে ঘট কোথা ভাসি যায়, মন কোথায়? বসো। So that is the external jugular vein, that is very important, and there is a clinical importance, because if this vein is cut, it will not retract because it is firmly attached with the deep with the superficial fascia. Okay, so it will not retract. There will be chance of air embolism. Air embolism, air will enter inside and it can enter into the heart, and it can enter into the pulmonary circulation. Sudden cardiac death can happen, pulmonary embolism. So when this vein is cut, immediately we have to secure it. Okay, so that is important point. So that drains into the this vein, the external jugular vein drains into the subclavian vein. Okay, and the subclavian vein and internal jugular vein joins to form the brachiocephalic vein. Now we can find there are several cutaneous nerves from the posterior border of the sternocleidomastoid, and among them one is going straight away upwards and towards the occipital region. This is the occipital region. This is the occipital region. So that nerve is called lesser occipital nerve. Root value is, you can see, we can see that is the C2. That is second cervical nerve. All this cutaneous nerve, you can see C3, C4, C2, C3. That means they are coming from the cervical, they come cervical region. And they are the branches of the cervical plexus. Another nerve, and this nerve actually hooks another very important content, which is called the spinal accessory nerve. So spinal accessory nerve is another nerve. This is actually the content of the triangle, which has been hooked by this lesser occipital nerve. Now we can get another nerve which goes transversely and it can reach the anterior triangle. Okay, this is called transverse cutaneous nerve, which has got ascending and descending branch. Ascending branch joins with the cervical branch of the facial. So there is a communication. Cervical branch of the facial and the ascending branch of the transverse cervical nerve. You can see the ascending branch and descending branch. This supplies the anterior part of the triangle. Another nerve which goes down and it divides into three branches, like Trishul. The lateral one is supplying this area, this joint, acromioclavicular joint, lateral one. Medial one is supplying this joint between the sternum and the clavicle, the sternoclavicular joint. Now in the intermediate one actually pierces the clavicle. Okay, the intermediate one pierces the clavicle. Clavicle is called a dermal bone because it is been pierced by the intermediate branch of the supraclavicular nerve. So this is root value is C3 and C4. So we can find all these structures in the, and also we can find the investing layer of the deep cervical fascia. So when we remove all this, we get, so this is another picture where we can see, this is the lesser occipital, transverse cervical, supraclavicular, and another nerve which supplies. If we come to the previous picture, we can see this is another nerve which originates from the same region. This is the posterior border is very important. Very important because all this cutaneous nerve and the spinal accessory nerve which supplies both the sternocleidomastoid and the trapezius, they come out from the posterior border of the sternocleidomastoid. So if there is an abscess, like tubercular abscess or any abscess developed due to there is a condition, there is a infection of the scalp on the, which is very much not very uncommon, like seborrheic dermatitis and other if it is get infected, you can get a swelling, a lymph node swelling at the posterior border of the sternocleidomastoid. You can get it. And a young enthusiastic surgeon suddenly cuts it and damages all these nerves along with the spinal accessory nerves. Now, what is the action of the sternocleidomastoid? When one muscle, the one muscle of one side contracts, head will move to the other side. When both the muscles contract, so head will go down. There is a flexion of the cervical part of the vertebral column. So that will be lost. Okay. So these are the nerves. Oh. So we can find another nerve which is coming out from this area, that is a great auricular nerve. We know that which supplies this area, a small area around at the angle of the mandible. Okay, because we know the whole area of the face is supplied by the cutaneous sensory supply is by trigeminal nerve. Trigeminal nerve actually supplies the face, and it is the sensory cutaneous nerve, except the mandibular division, which has got motor nerve also. Except this area, that area is supplied by that great auricular nerve that is coming from the cervical plexus. So this is the floor. We can find there are so many muscles from above downwards. We can find that is semi-spinalis capitis, splenius capitis, levator scapulae. We can find scalenus medius posterior, and first digitation of the serratus anterior. We can find so many muscles from above downwards. We can this is the semi-spinalis capitis. All the muscle has the muscle fibers which are directed downwards and backwards and laterally. Except this semi-spinalis capitis with muscle, the fibers are directed upwards laterally. So semi-spinalis capitis, splenius capitis, levator scapulae, scalenus medius. Behind we have scalenus posterior, and we are also getting, which is not seen in here, that is a first digitation of serratus anterior. So these are the muscles forming the floor, and the muscles are covered by another component of the deep cervical fascia, that is called prevertebral layer of the deep cervical fascia. So in front is the investing layer, behind is the prevertebral fascia. So in between we are getting the posterior triangle, and we are getting the contents of the posterior triangle. The same thing you can see, scalenus medius. So subdivision of this triangle, okay, one is subclavian triangle or the supraclavicular triangle, that is the occipital triangle. Now, what are the contents of the occipital triangle? In the occipital triangle, we can see one artery. This is actually originating from the external carotid artery. We can see it in the anterior triangle. So it goes behind. It actually, we can find, this is the posterior belly of the digastric. At this level, we can get that artery. Okay, just below it. Then it goes below behind the posterior belly of this muscle. Okay, digastric muscle. Then it ultimately reaches and crosses behind the sternocleidomastoid, and this is visible in the posterior triangle, that is the occipital artery. Okay, occipital artery. Occipital triangle will contain occipital artery. The next one, we can find genuine content of this posterior triangle, that is the spinal accessory nerve. We know that the 11th cranial nerve has two components. One is cranial accessory and another is spinal accessory. Spinal accessory is coming from the anterior horn cells of C1 to C5. So their components are coming and joins and ultimately reaches there, okay, through the jugular foramen, and it joins with the cranial accessory and ultimately supplies these two muscles. That means Sternocleidomastoid and the Trapezius. So this is the spinal accessory nerve. Okay. Then we can find other nerves also. We can find parallel to each other. Okay. Like we can find this nerve, which is parallel to the spinal accessory nerve. We can find another nerve which is coming from the cervical plexus, that is the C3 and C4 fibers. This spinal accessory nerve and this C3 and C4 fiber, they go behind the trapezius muscle and we get the subtrapezoid plexus, where around 5 centimeter above the clavicle. Okay, it reaches and it forms a plexus. Now, trapezius is supplied by both by the spinal accessory nerve and the C3 and C4 nerve. Why? Why? What is the function of the spinal accessory? Movement of the trapezius. So there is a motor action, the sensory action. The sensation is, a muscle sense is carried by this C3 and C4. Okay. Similarly, sternocleidomastoid is supplied by this spinal accessory, but it is also been supplied by C2 and C3 nerves. C2 and C3, they actually senses the muscle sense. There are muscle spindle which actually senses the tonicity of the muscle. You know, in your physiology. So C2, C3 is for the muscle cells. Now the other components we can find this nerve. This is the dorsal scapular nerve. We know this is the libata scapulae over which we can see the spinal accessory nerve is resting. And dorsal scapular nerve we can find in here, and it will go below this libata scapulae or it can pierce the libata scapulae and it goes to supply the other muscle. Elevation of the scapula, libata scapulae, another same group of muscles. কালকেই বলেছি, তুমি বলে দাও। Elevation of the scapula, libata scapulae, and other muscle, rhomboidus major and minor. So they are being supplied by this dorsal scapular nerve. It is coming directly from the root of the brachial plexus. Brachial plexus, C5, C6, upper trunk, C7, middle trunk, C8, T1, the lower trunk. ভুলে গেছো? দেখতে পাবে। So that is the dorsal scapular nerve. Also we can find these vessels. This is the transverse cervical artery which is coming from the thyrocervical trunk. We know the different branches of subclavian artery, bit, C, D. V means vertebral, internal thoracic, then thyrocervical trunk, C costocervical trunk, D dorsal scapular. So there are so many arteries we are getting. So the thyrocervical, that means it supplies the thyroid, inferior thyroid artery, and we can see this is the transverse. This is the transverse cervical artery. Okay, and again another artery we can get, that is the dorsal scapular artery. We can get the suprascapular artery also. So we can find these arteries there. So these are the contents. First, this is the inferior belly of the omohyoid. So above we will get all this spinal accessory, C3, C4, dorsal scapular nerve, transverse cervical artery, and also the dorsal scapular artery, and so and so. And other some ramifications, several other branches coming from the cervical plexus, but of the cervical plexus we can get. So this is the supraclavicular triangle or the subclavian triangle, where we can get this one artery, that is we can get this artery, that is a subclavian artery, which we can discover in our cadaver. So from here we can see this triangle is named as the subclavian triangle because of the subclavian artery is present within it. Okay, and we can find the trunks of the brachial plexus. We can find the subclavian artery, and we can find the trunks of the brachial plexus. We can see these are the trunk. We know this is the, we can find this is the upper trunk, this is the middle trunk. So this two trunk is also visible along with the subclavian artery. We cannot see the subclavian vein because this is the cut section of the clavicle. So it remains just behind the clavicle. So this subclavian vein is not a content of this triangle. So only the subclavian artery we can find. First part, second part, this is the third part. The part which is visible, this is the third part of the subclavian artery, which is visible in the subclavian triangle. And also we can find this is upper and middle trunk. Lower trunk is not visible, it remains at a lower level, and it is at the in direct contact with the first rib. This is the lower trunk. We can find the continuation of the, here we can find the lower trunk. Okay, so which remains in close contact with the first rib. Okay, so these are the contents, and we can find this is scalenus anterior, this is the scalenus medius. In between we are getting these neurovascular structures. So that means neuronal structure, upper and middle trunk, we are getting the subclavian artery. So we will search all these structures or content of the subclavian triangle in the cadaver also. Now this is the old picture, that is C5, C6 forms the upper trunk, C7 is continued as middle trunk, and C8 and T1 it is the lower trunk. We know the previous knowledge, as per our previous knowledge, only the upper trunk has got two nerves. Which are those nerves? We can see supraclavicular nerve and nerve to subclavius. Only the upper trunk gives. Whereas we can find these are coming from the roots. It is coming from the root, and this is also coming from the root. This is dorsal scapular nerve, which is visible, and this is the long thoracic nerve which supplies the serratus. Anterior muscle, so they are coming from the roots. And we know this upper trunk, middle trunk and lower trunk, when it reaches towards the clavicle, it divides into anterior and posterior, anterior and posterior, anterior and posterior division. Okay. And anterior division of the upper and middle forms the lateral cord. Anterior division of the lower one forms the medial cord. And posterior division of all these trunks joins to form the posterior cord. So this is as simple as anything. If you can understand, then you can remember. So why we are very much interested about the brachial plexus now? Because we have to see the upper and middle trunk. Lower trunk is at a lower level, which is at the level of the first rib. So it is, we cannot see it here, but we can search the upper and middle trunk. Upper, middle, lower. 3 trunks. Because we have to know this, all these things, because brachial plexus block is given and we can feel the subclavian artery. Okay, so that is an important one. We know the Ups palsy, upper trunk, union of 6 nerves, C5, C6, then anterior division, posterior division, and the nerve to subclavius and supraclavicular nerve. So that is during the birth injury, there is sudden separation of the head and neck, and which can give the Ups palsy. And that is in the lower trunk palsy, which is called the Klumpke's paralysis. C8, T1 is affected.